Hello viewers, welcome back with an interesting knowledge session from BLK-Max Hospital. I am Dr. Suhas Parnami, Medical Superintendent at BLK-Max Hospital. We have Dr. Nidhi Kheda, who is the Director at BLK-Max Center of Women Health. Today on the occasion of International Women Health, we will be discussing a very important topic, which is menopause. Good morning.
Thank you.
So please, if you can tell our viewers, what is menopause?
Thank you, Dr. Suhas, for picking up such an important topic for discussion on the occasion of Women's Day. Now, traditionally, we have been brought up with the mindset that a woman is supposed to take care of her health during her early days, during the time of a pregnancy, childbirth, and then growing up. And gradually, when they become busy with their careers, with their household work and all those pressures, somehow it has been seen that when they come to this such an important transitional phase of their life, that is menopause, their health priorities, their challenges and their concerns have gone down very low on priority. And also another important reason is that probably we are trained to believe that this is normal. This is going to happen, so whatever challenges you have during menopause is a part of your system. So therefore, we don't really have to go out and seek help, but that is not the case. In fact, today the scenario is changing widely. The average life expectancy of a woman has really gone up, and generally for all of us in general. So the life expectancy maybe decades earlier that was at around 50, 60, now we are talking about 80s and 90s. So that means if you have the average age of menopause setting in a woman at around 50, 51, she'll be looking at spending practically 1/3 of her life in this transitional phase. So that's why it's extremely important that we learn to focus on this and we just don't accept these changes as part of it, and we keep suffering and we keep, like, those problems keep lingering on in us. It's now the right time to come out, talk about it, seek help so that this journey also becomes comfortable for them.
So I think women in general have become a little more open about these issues, but yet we have that population who probably either do not understand what's going on with them, or if they do, they're really not able to share it with the other people. So like rightly you said that it's time that it should be discussed and you should come out with it to get the maximum help of it, right? So what are the common issues, ma'am, seen in menopause? What are the challenges which a woman has to undergo during menopause?
So before we go on to the challenges or the issues, something that I really would want everyone to understand is what exactly do we mean by menopause? So that is the cessation of periods if she stops getting her cycles for 12 consecutive months. So she's not had any cyclical bleeding, she's not had her periods for 12 months or 1 year. That is the time we take it as menopause. But it just doesn't happen overnight. So there might be certain changes in the body because the body starts preparing for it. So that transitional phase has become a couple of years before that, and that is what we call in our terms as perimenopause. Why it occurs is because the ovaries that are traditionally producing the hormone estrogen, so the ovarian function starts declining gradually with passing years, and because of the decline of this hormonal support from the ovaries, that is why you go through these changes. Now these ovaries and the ovarian hormones were a very important and an integral part of a woman's body. So they were acting on a lot of tissues from head to toe, and not just as a reproductive hormone. And now once that support is gone, so that is why it's like all havoc created and all hell broke loose kind of a thing, like that. So a lot of changes start up in this system. So if we were to go from head to toe, there are a lot of mood swings that are happening. So I always tell my patients, anytime you're not feeling up to it, you can generally say it's menopause and get away with it.
Right.
So there are so many mood swings that are going, there are so many emotional ups and downs they are going. You start getting these hot flushes. Now only a woman at this age would understand how difficult it is to cope up with the hot flushes. The others sitting in the room would probably not even relate to it. 1 second you will be feeling a sudden gush of blood going to your head, a sudden wave of heat going to your head, and the next time you're feeling that sudden wave of cold. So you get those cold sensations and those heat sensations, and they occur just so erratically that make your socializing difficult, that make your going out difficult, and they do interfere in certain situations with the day-to-day routine. So that gets affected. You have other problems also, because estrogen forms a very important protective role for the women's body, in the sense it has a very important and a protective role for the women's bones. So that protective effect gets lost, and therefore you go through an accelerated phase of osteoporosis or bone loss. So the bones start shrinking. You might have seen elderly women, they shrink in height. So somebody who was 5'5", like our grandmothers when we saw them, so they had suddenly shrunk in height, and that is because of the bone loss that starts occurring typically more after menopause. Then the protective effect on the heart also starts going. So they are more prone to getting cardiac attacks and more prone to those events post-menopausal. And that's again one of the very important reasons why you'll see that more men have heart attacks as compared to women in the premenopausal, because this estrogen has a very protective role. And after menopause sets in, then that protection is lost. So they are also equally prone. So we need to be careful about that. Then they go through a lot of vaginal dryness, because that is estrogen again is required for maintaining the vaginal softness and suppleness of the tissues. So that having gone, the tissues become dry. The bladder support around that area also gets denuded and lost. So they start having a lot of those urinary symptoms. She just gets that urge to go and pass urine more frequently, and again that makes social life a lot of times very difficult. So the urinary frequency gets increased, there is a lot of irritation, there is a lot of vaginal irritation, there may be itching, and sexual life also gets affected. These are just to come down to a few, but overall if you look at little nagging things developing, so life does become difficult. And the sad part is we are made to believe that ये तो होना ही है, ये तो ऐसा तो होएगा ही, इसके लिए थोड़े आप जाओगे हॉस्पिटल दिखाने, हमको नहीं हुआ था या हमारी मम्मी को नहीं हुआ था, सो जस्ट चुप रहो, घर में बैठो और उसको सफ़र करते रहो, बट नॉट एनी मोर.
सो विच इज़ आई थिंक आप बिल्कुल ठीक कह रहे हैं मैम, क्योंकि मुझे ऐसा लगता है कि जैसा आपने समझाया ये सब प्रॉब्लम जो एक वुमेन को झेलनी पड़ती हैं, पूरा वर्ल्ड टर्न अराउंड हो जाता है वुमेन का. कोई नहीं समझ सकता कि उसके अंदर चल क्या रहा है. तो ये ऑल द मोर इम्पॉर्टेंट हो जाता है कि जो उसके आसपास के लोग हैं या उसके चाहने वाले हैं या उसके पार्टनर हैं, खासकर मेल, वो ये समझे कि वुमेन के साथ क्या हो रहा है, क्योंकि हमें उनको सपोर्ट करना बहुत ज़रूरी है. आई होप मैं ठीक कह रहा हूँ.
Absolutely, absolutely.
तो ये
because unless she has the support of her family,
you will not be able to get through this. बिल्कुल बिल्कुल. सो ये बिल्कुल गलत होगा कहना कि ये बिल्कुल हमारे साथ ही होता, ये हुआ है सबके साथ तो इनके साथ नॉर्मल है, ये गलत है. वी शुड नॉट से दैट. एंड आई थिंक वुमेन ऑफ टुडे इज़ आई थिंक नॉट बाउंड फॉर एनी रीज़न टू बी कंट्रोल्ड बाय दीज इमोशन. सो मैम एक लास्ट सवाल आपसे. ये जो मेनोपॉज है, अगर ये हो, ऑब्वियसली एक नेचुरल साइकिल है होगा, बट इसको रेमेडी के तौर पे अगर कुछ हेल्प हो सके विमेन की, वो कुछ ऐसी चीज़ें कर सके जो ये जो सिम्टम्स हैं या जो ये इश्यूज़ हैं ये थोड़े से कम हो जाएं या फ्रीक्वेंसी कम हो जाए, ऐसा कुछ अवेलेबल है मैम?
सो डॉक्टर साहब आपने बहुत अच्छी चीज़ बोली कि ये नेचुरल प्रोसेस है. सो नेचुरल प्रोसेस है तो इनएविटेबल है, एंड ये एक पार्ट ऑफ ग्रोइंग अप है, ये एक पार्ट ऑफ एजिंग है. सो दिस इज़ नॉट अ डिजीज़. वी डोंट नीड टू हैव दैट टैबू विद इट दैट ये बीमारी है इसलिए मुझे उठ के जाना है. इट्स जस्ट अ पार्ट ऑफ माई सिस्टम एंड सम चेंजेस इन माई बॉडी फॉर विच आई नीड टू टेक हेल्प. एंड the important thing to realize here is we don't go for help when we reach 51 or 52 when you get into menopause. Ideally, women's health is a continuum, like we say from womb to tomb. different ages पे different stages पे हमें अलग अलग requirements, अलग अलग चीज़ों की ज़रूरत है सिस्टम और बॉडी के हिसाब से. सो जो मेनोपॉज की तैयारी है वो 50-51 पे नहीं शुरू होती. आइडियली हमारी ये तैयारी शुरू हो जाती है एटलीस्ट उससे 10 साल पहले. अब हमने क्या किया, डिलीवरी हुई, उस समय तो आयरन कैल्शियम खाया, उसके बाद बड़े आराम से भूल गए, उसके बाद दोबारा ना कभी चेकअप के लिए गए, ना कोई हमारे प्रिवेंटिव चेकअप्स हुए, ना हमने कोई एडवाइस ली. बट हमारा बोन लॉस तो वहीं पे शुरू होना शुरू हो गया है. सो The moment you cross 40, it's very important to take care of your bone health so that it doesn't hit you more when you reach that stage when the support is gone. So a proper calcium supplementation, vitamin D supplementation, and a very important thing that helps you tide over the osteoporosis is regular exercise.
Okay.
In fact, that is one of the most important interventions that you can do in your routine, is to increase the physical activity. So a regular exercise at all stages of life to keep your flexibility, muscle power and all those things in place. So that is one intervention that you start. You increase and you change your diet in such a way that you not necessarily have to go in for HRT or hormones after menopause. So there are certain plant hormones also available, so the phytoestrogens we call, and they can be added to your diet.
Okay.
Simple things that you can do in your diet is to increase the intake of soy and soy products. So soya bean, soya milk, natural or flavored, whichever you are comfortable, broccoli, tofu, flax seeds. These are those simple things which really add on to the phytoestrogens in your diet. So that is the second thing that you can do as you are going through that transition phase. Now, to make your life comfortable when you start getting these symptoms, so like for hot flushes, you need to maintain a comfortable temperature of the room and the environment. You need to have those loose fitting clothes, avoid wearing synthetic clothes, and just have comfortable cotton garments. That is to be taken care of. You need to take care a lot about your water intake, your fluid intake, because a lot of time they'll have bloating and distension. So you need to take care of those things.
Absolutely.
You need to take care of other changes in your diet, step up the proteins, cut down on the carbs and the fats that is going to cause more of our side effects. So step up the proteins, step up the exercise. For vaginal irritation and the bladder irritation or the urinary symptoms, again to have a controlled water intake. And then there are certain local lubricants that can be prescribed. Even some local estrogen creams can be prescribed. If the general measures don't work, then there are certain specific medicines which can be started to take over and to tide over that short phase. जनरली ये सारे जो सिम्टम्स होंगे ज़्यादा तंग करने वाले, हमारे व्यूअर्स को ये नहीं लगना चाहिए कि मेनोपॉज का मतलब है हमने इतनी सारी चीज़ों की बात करी है तो ये सारी की सारी मुझे होने वाली हैं और ये सारी ज़िंदगी मेरे साथ चलने वाली है फ्रॉम 50 to 80. So menopause care transition usually takes about 1 or 2 years, and by and large more than 90% of women get comfortable in a couple of months to these changes in the hormones, the stoppage of estrogen. So then gradually it gets settled. So we may have to give in some situations some medicines to tide over this short phase. But a good point would be that not to self-medicate, especially HRT and other things. So you come for a proper checkup and an evaluation so that we are able to see what is required in your particular situation, which will cause the least possible side effects and yet give us a comfortable lifestyle. And yes, at the Center for Women's Health, we have a dedicated team that takes care of the menopausal issues. We have a whole staff that takes care of all the problems to give them guidance at the right stage that they are there.
Wonderful. So, thank you, Dr. Nidhi. I think this is a natural, menopause is a natural progression of aging, and it will not only lead to a little distraction, or I would say a little discomfort, but it can be identified in pre-menopausal times, and with, as like rightly Dr. Nidhi said, with diet, with exercise, with supplements, you can keep these symptoms under control. Also, even if you need help, there is a dedicated team who's taking care of the menopausal issues, but please do visit your consultant physician to understand what help do you need. So thank you again, Dr. Nidhi.
So
any last points you would like to tell our viewers?
So just one line, though the word says it is menopause, but it is not menopause. I will
Wonderful,
go on.
Wonderful. That's a best acronym anybody can have. Menopause. Very nice. Thank you so much, viewers. We were in conversation with Dr. Nidhi Kheda, who is the director at BLK-Max Center of Women Health. Thank you so much. Stay tuned for more interesting sessions.